Hello, everyone, and welcome again to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and the support of Multicultural New South Wales. I'm Jesusa Helaratne, your moderator for today, and we'll be giving you your answers to questions that you have on COVID-19 and vaping. Today, of course, we have our Senior Medical Advisor, Dr. Jan Fizzell, as always, and a special guest, Ms. Carolyn Murray, Director for Centre for Population Health of the Public Health Branch. Thank you so much for joining us today. So before we begin, we'd like to acknowledge the traditional owners of the land from which we are all meeting from today. Dr. Jan, Carolyn, and myself were acknowledged the traditional custodians of the land, the Camaragal people of the Guringai tribe of the Eora Nation. We pay our respects to elders, past and present, and extend that respect to Aboriginal elders and colleagues, and we also acknowledge the elders from all multicultural communities represented today. Throughout the session, we encourage you to ask your questions, put them in the chat. We'll also be putting some links to some multicultural and translated resources that you can use on COVID, and hopefully, if you have any questions, we can send you the links as well. And throughout the session as well, if you have anything that you'd like to add, we want to tell you today as well that we're giving you updates on COVID, but we'd also like to focus on key health topics that will be relevant for the community. So if you have any suggestions, topics that you'd like us to tackle, please let us know. So let us begin. Dr. Jan, do you have any updates today?
Yes. So yesterday, we recorded 12,297 positive cases in New South Wales of COVID-19. We unfortunately lost 14 lives to COVID-19. Our sympathies are with those families. We had 1,395 people in hospital, including 57 in intensive care, with 19 on ventilators. We're asking people to still remember the little things that can help protect us against COVID-19. Use the mask in indoor settings, particularly when you can't physically distance. Make sure you're up to date with your vaccinations. That could be your booster vaccine. That could be your winter booster vaccine. Get a test and isolate immediately if you have any of the symptoms of COVID-19, and keep those hand hygiene going. Keep washing your hands. Please make sure that you remember that with the new rules for household and close contacts in New South Wales, while you can leave home, you should be wearing a mask. If you get any symptoms whatsoever, you must be tested and isolate again. If you can, work or study from home. Don't go out and about as much as you can. Please don't attend high-risk settings such as aged care facilities or medical facilities unless it is for your own care or treatment. And if you are going to meet up with anybody, please make sure you do a rapid antigen test just to reduce the risk that you could take COVID to the people that you care about the most.
Thank you so much, Dr. Jan, for that update. And Carolyn, it's so nice to have you here to give us some information on vaping. One of the questions that's come up from the media is in terms of regulations. This is from Fatin Dana from 2MF Arabic Radio. In terms of regulation, what measures would the government take to stop sales of e-cigarettes online as children as young as 10 years old? Or what are we doing to address these issues for young children?
Thank you. Since January this year, New South Wales Health has seized more than $1 million worth of products. That includes e-cigarettes and the liquids containing nicotine, bringing our total since July 2020 to $3 million worth of product. Our health inspectors go out regularly. They go to retail stores, they do spot checks on retailers, and they can seize and bring the product back to the health department and it gets destroyed. If you're selling the products, there's a range of fines, but you can also be prosecuted. Some of those fines are also connected to a jail sentence. So New South Wales Health takes this very seriously.
One of the things that people are asking as well is that the e-cigarette users probably don't know that could it be that who test positive for COVID are more likely to experience COVID-19 symptoms? That's a question that's been asked. Dr. Jan and Caroline.
Yeah, so we certainly know that doing anything that can irritate your nose, throat or lungs can actually make the symptoms of COVID worse, or flu or anything else. So from a health point of view, vaping is not 100% safe. It certainly is something that, one, you don't actually know what's in the contents of a lot of the things that are being sold. And so you can actually breathe in things that irritate your airways and your lungs. The second thing is if people are sharing the e-cigarette or the vaping device, you've got your saliva on that. And so it's a good way of transferring COVID, plus all sorts of other interesting germs. And then, of course, the fact is that because it's not something that people know what's in it, you can actually get this real pneumonitis type thing. So you could have symptoms that were like COVID, with a cough and irritation. And you then are in this point of, do I have to go and get tested? Don't I need to go and get tested? So even though I know a lot of people have said, we think it's safer than smoking, because so many of the people who are using vaping devices at the moment are actually young people who have never been near a cigarette, probably never want to go near a cigarette. But then as they get older, we see it happening that people who've started vaping when they were younger sometimes graduate to smoking cigarettes. So the fact is, for so many of the people who are using these devices in New South Wales at the moment, it's not actually a safer option for them. It is actually something that is detrimental to their health.
Thank you, Dr. Jan. And Carolyn, what are in these products, these e-cigarettes and liquids? What are they?
Yeah, so New South Wales Health recently launched a campaign for young people. It was also for teachers and parents. And that was to tell them about the facts of what's in vaping. And we've seen chemicals that are in weed killer. We've seen chemicals that are in bug spray. We've seen chemicals that are things like in nail polish remover. And they might be a product from the e-cigarette itself, or it might be something that comes from the e-cigarette when it's heated. So alongside that, there's also heavy metals, so things like copper and lead also that you can breathe in. But part of the aerosol that comes off them, there's also some really fine particles that can go into your lungs as well. And as Jen said, your lungs are a very sensitive tissue. And so there is great concern around what's in these products.
Thank you so much, Carolyn. Dr. Jan, a question for Biljana. Can vaping lead to cancer, and what are the risks for cancer?
So they're still fairly new devices, and it often means that you've had exposure for a long time before you actually see the cancer outcomes. Some of the chemicals are definitely things that could promote cancer. If you were a very long-established smoker and you've gone to see a GP, got a prescription for a regulated device, your risks are probably lower using an e-cigarette than smoking. But for most people, the safest thing to do is to not use an e-cigarette and to not keep smoking. Because one of the things people tell themselves is, I'm using my e-cigarette, I'm quitting. And then what we see is people actually wind up with more of a hybrid happening, where they're actually using the e-cigarette to to use, to supplement when they're out and about, and then smoking when they can smoke at home. So we're not seeing that same sort of really good quitting, I think, rates from even adults using these products. So the safest thing is to talk to your GP, try other ways of quitting, use our quit line to help, which, is also available in a number of languages. And so really important that people don't sort of say, I'm just going to vape instead, because vaping instead is not the same as quitting.
Thank you, Dr. Jan. There's a question here from Viola Calvert from the Filipino media. Radyo Tagumpay, is there any age requirement for selling to minors?
So the law in New South Wales is it's illegal to sell any tobacco product or any vaping product to anyone under 18 years of age. And we encourage retailers that when someone comes into their store and they're unclear about how old that person is, it is hard to tell these days, that they actually ask for a form of ID, so their license or their youth card or something like that, to actually prove that they're the right age to be using these products.
Thank you so much, Carolyn. We'll go back to COVID. Russell Anderson from NEMBC is asking, not everyone is reporting the positive rats. Is there any recent data about how many people might not be reporting, or any anecdotal evidence to know a percentage of what's not being reported? Dr. Jan, what is the best thing to do?
Look, what we are seeing from our numbers and translating those numbers through to what we're seeing in hospitals and ICU, we think we actually do have quite a strong reporting culture here in New South Wales. So, we're very grateful for that. We know some people are still uncertain about what to do when they have a positive rat. And the really important thing is that they do register that rat was Service New South Wales. And one of the reasons why that registration is so important is it's a bridge to getting help, particularly because we now have these antiviral medications, and the antiviral medications work best when given within 5 days of onset of the illness. And so by registering that RAT through Service New South Wales, you get a questionnaire. That questionnaire can help us understand whether you're a high-risk person who actually needs additional help and is eligible for treatment. And then we can help either facilitate your engagement with a GP, your GP, if you have a GP, but if you don't have one, another GP that's available to help you work out whether you are eligible for antiviral medications. They're now on the pharmaceutical benefit scheme, on the PBS, and subsidised. And it's really important that people do get access to that treatment. We've now got 2 drugs available on the PBS to treat COVID-19. So people who are immunosuppressed, people who maybe have chosen not to be vaccinated, who are at very high risk of winding up in hospital, people who may have other significant health conditions, are all eligible for early treatment. And so it's really important that people do stay in touch with their GP, or, as I say, register that RAT test and follow those instructions. If anyone's concerned that they're not quite sure what that is, our testing positive to COVID-19 fact sheet that's available in a number of languages does have that link into our Health Direct COVID care line. So people can call that line and they will help you navigate your way either to a GP or to treatment.
So thank you so much, Dr. Jan. So we don't want to even complicate COVID with having these illnesses that could come from using e-cigarettes, isn't it, Carolyn?
That's right. I mean, I think the thing to remember with vaping, and Jen's talked to this point as well, is we really are unsure what's in them. We get the packets and the vapes themselves when we seize them. Most often they don't have that they have nicotine in them. Most often they don't talk about the chemicals that's in them. And one of the things we want to make clear today is that the likelihood of you purchasing a product at a retail store of a disposable vape is that it will have nicotine in it. And that's damaging for young people's health and their development, their brain development and body development as well.
So what support can be provided for carers, for parents? What should they be doing? What should they be looking out for?
Yeah, so the first thing we talk to parents about is to talk to young people about it. So to ask them about whether or not they're vaping, whether their friends are vaping, have they talked about it at school? Our resource kit, the link's online there for you, I can see, has a range of products for teachers and parents to talk to young people about, and there's also some products for young people themselves. I think the most important thing is that young people understand the facts. Our young people in New South Wales are bright and clever, and they understand and need to make informed choices about what they're doing, and our information on our website will help with that. So I'd encourage any parent or any teacher or young person to go to our website.
Thank you so much, Carolyn. Dr. Jan, given that, there's a lot of, because this is harmful for young people, and mental health issues, well-being, a lot of stress, this causing, alternative ways to de-stress.
Look, I think vaping can sometimes be a social event where somebody's, managed to acquire something. It's something that's new and novel. And let's face it, many of us haven't had much that was new or novel in the past couple of years. And I think it's really important for those dialogues between parents or a trusted adult, because I know not everyone wants to talk to their parents, making yourself available, particularly if you're a trusted aunt, uncle, family, friend, so that you can talk to people about it. Because as Carolyn said, one thing that we've learned from COVID is our young people are amazing. They want to make smart health choices. They want to look after themselves. They want to look after the planet. And it's really important that we help them understand that if they've got something and they think it's novel, it's harmless, because I could just buy it from somebody very easily, trying to help them understand that actually you don't know what's in it. You're doing something that when you inhale it is actually one of the most direct ways you can actually get a chemical from outside your body to inside your body, which is why COVID works so well as well. You breathe it in, it goes, So it's really important, though, that young people are given not just a finger wagging, don't do this. It's actually having that dialogue about what's going on, why is this attractive to you, and did you know these things could happen? Because, as Carolyn says, our young people are amazing. We saw this right through COVID. We've seen this through this. They have been under enormous mental health. They've had lots of stresses, and friendship groups are often, you know, in flux at the moment as people come and go. And this could be something that's binding a friendship group together. So I think we have to be really careful in navigating those conversations with young people to make sure that, you know, the attraction of the vape and being in with that particular group of friends as we rebuild that, versus being able to say, look, I understand, but it's not for me. And that's a really hard conversation when you're a young person. But as I say, the more we give people the tools, the more we help them with the words to be able to have those conversations with their peers, the easier it'll get for them.
Yes, and Carolyn, there are, as part of the campaign, there are resources available for parents, for teachers, and also for young people.
Yeah, I mean, the resources were developed with young people and teachers, in fact, and also some parents. So, I mean, I'm really confident that they will give the information required to whoever looks at it. We're also working on some pieces of work around, for young people, I guess, around what they can say. So the words to say it, like, no, I don't want to vape because I don't know what it does to my body. Oh, look, I'm not interested in smoking. I know that if I sort of start vaping, I could go on to smoking. In fact, the evidence shows that young people are 3 times as likely to go on to smoking. So we do have some resources that allow young people to use those words. But it is about confidence. And I understand that for some young people that might be a challenge, but also talk to your other friends, because the other thing that we do know is not all young people are doing it. So talk to those young people that aren't doing it as well.
Thank you, Carolyn. A question has come up with about, you know, yes, there's e-cigarettes, but there's also the fact that there are other tobacco alternatives, for example, shisha. So is this place together with vaping, or there's questions about that?
Yeah, I think there's, you know, the cultural impacts of shisha is also important. I understand the cultural impacts of those, but looking at smoking itself, which is the tobacco and not vaping, we know the impact of tobacco. Young people, for example, would know the impact of what cigarettes do to your body and brain and lead to cancer and those sorts of things. So I think, again, it's about understanding the correct information, understanding the risks and the risks that you're taking, and then working with your family and friends to how you can not do that, or how not to get caught up with your friends and peer pressure and those sorts of things.
Thank you so much, Carolyn. A question has come up. What current trends of Omicron, and this is now Omicron COVID, what is circulating around the community? And if someone has had one strain of Omicron, does this offer immunity against the strains of virus?
So at the moment, it's largely still BA2 in New South Wales, which is not surprising because it's one of the more dominant strains around the world. We are starting to see cases of BA4 and BA5 here in New South Wales. Unfortunately, what we're starting to see is some people getting reinfected. We've certainly seen a whole lot of people who maybe had COVID during the Delta wave. Now, there's been a lower booster uptake in some of those communities. So I'd really encourage those communities who know that they got hit hard during Delta to have those conversations with each other, because the booster is really important. And that Delta doesn't give you a lot of protection against Omicron. And some of the people who might have got Omicron in, say, December last year, their immunity from that will be waning already anyway. So it is really important that if they missed the booster because they were sick with COVID, then it's now time to get the booster, and it's time to help our older people get that 4th dose, that winter booster dose, simply because we know it's winter. We know that we tend to go indoors, and it's really important, I think, especially we've been blessed with some nice days in Sydney after all those weeks of rain. When we have a nice day, please try and meet outdoors, try and, you know, catch up with friends, you know, maybe having a walking, you know, chat rather than sitting down in the cafe, because the more we do outdoors, the more we do with good ventilation and good spaces, the less likely we are to have COVID at our family gatherings, because it's one very unwelcome guest.
Thank you, Dr. Jan. And I guess if you are sick, don't vape, don't use e-cigarettes.
Yeah.
You got COVID, because you could. The question about advantages of vaping compared to smoking traditional cigarettes, and you mentioned that, and if we were to advise kids to just understand that this is important for their friends not to use it, if they're not using it, don't use it as well.
Yeah, that's right. And I think the thing I'd say is the alternative. There are conversations in the community around vaping being safer than smoking. That is not the case, and particularly for young people, because they do contain those chemicals. And as I said before, they particularly contain high levels of nicotine. And the concern with that, of course, is that you become addicted and then you become either a vapor for life often or a smoker. And so the request, I suppose, is to get young people to understand the facts of the matter and what they're really doing and what's in those products, even though it might not be on the packet, to really understand what that is and what it means for their future health.
Yes. And I think one of the things is, up until recently, our smoking rates in young people have been plummeting, and the likelihood that a young person would be using any sort of nicotine device, vaping or smoking, was really very, very small. And so this is a worrying intervention, that a whole group of young people who were never going to smoke are now actually exposed to vaping, have that sort of same peer pressure that many of us when we were younger and at school would have experienced. If you wanted to be friends with these people, you were smoking. And if you weren't friends with those people, who were you? So I think it's really important that we understand that this is actually a new threat to young people, because our current generation, lowest amount of drinking, lowest amount of smoking. They're a very caring generation who take really good care of themselves and each other. And I think this is just another way they can help do that.
Thank you. Carolyn, what is the message that multicultural media who are online today should be telling and should be sharing to their readers and audiences?
I think there's a range of messages. So the first message is for young people to get the facts, so to go to the website and advertise that to them so they can understand exactly what's going on and what the products are, and what they can do to help to quit or help a friend quit. So that would be really useful. I think the other message to the communities are to the retailers. So New South Wales Health takes very seriously if people are selling vapes at their corner store to young people particularly. We take that very seriously. It's illegal to sell vapes containing nicotine to anyone in New South Wales, except if there's a prescription and it comes from a doctor and you purchase it at a pharmacy. So that would be our second message, would be that retailers are really on notice, and that our enforcement officers will be coming out to inspect the stores to see if they're being sold in the community. And the purpose of that is to protect our young people.
Carolyn, does cost matter? Does make a difference with the cost of e-cigarettes?
The cost of vapes they've actually increased in cost recently, and so I imagine compared to a cigarette they are cheaper, but I think you have to weigh up the health costs of vaping. We have had cases of Vaping, which is an e-cigarette lung disease in New South Wales, and which is quite dangerous to young people. And we've also seen a lot of other young people in a sense, get poisoned or get sick from the levels of nicotine in it. So we've seen some increases in calls to the poison information line. So, they're not harm-free.
They're not harm-free.
Yeah. And if anyone does have a vape in their household, having a really good look at the packaging, because we do see very young children get attracted to the smell, because they often have fruit smells or other things else, and then they drink the vaping liquid, and that can be lethal to a very young child. And so really important that keep out of reach of children, and preferably completely out of reach of children.
And with that, that's immediate harmful effects, isn't it?
Yeah, there's that's a trip to the hospital, if not to the intensive care unit.
So we've had questions, Carolyn, about vaccination of having long-term effects for children, right? And this is more than that.
Well, there's the immediate harms. And then there's the long-term harms, and I think that's one thing that we're still learning.
It is, and I think what we're going to find actually in one of the in some of the research, I suppose, is that as the years go on and people continue to vape, I think what we'll see is that evidence come through, and we're starting to see that now. So the evidence is starting to come through about the harms. And there's a very good study done by ANU that was released recently, and that actually listed all of the harms from vaping, and it's a very good report to read. It's very long, but it's a very good report to read.
Thank you. So we'll probably share that in the link to, if we can
We can
share
do
that
that.
to the link to when we send the recording to everyone. Dr. Jan, a question from Russell Anderson from NEMBC. The AMA, or Australian Medical Association, recommended reintroducing masks in high-risk settings, stadiums, theaters, and supermarkets. What is New South Wales doing to encourage people to still use masks?
Look, I think it's really important that we've learnt so much about COVID. We've learnt so much about the spread of disease and how important that face masks can be in helping protect you and helping to protect others. So that's why the New South Wales health advice continues to be, if you're in an indoor area where you know you may not be able to physically distance, and that includes theatres because you have people right up to next to you. That includes stadiums where people may be yelling or shouting or just really enjoying themselves loudly. It could be a rock concert, could be wherever. If you've got a whole lot of people making a whole lot of noise around you, wearing a mask is not a terrible idea. And again, even thinking really carefully, we will ask you to wear one in our healthcare facilities, and that is to protect other people, and it's really important. And the only reason why we are sitting here without masks is because this is a communications forum, and when it's a communications forum, we know that a lot of people do lip read, and so that's why we don't have masks on at the moment. Otherwise, we would be wearing masks. You've seen Jess sometimes do this from home if she's not been well, so it's really important that we keep those COVID safe behaviours, because it is a little thing. I know for some people they feel like it's this, but maybe not a good example, but my middle-aged husband rides his bike home from work and I look at him and say, honey, you've still got your mask on. So it can just become part of the furniture when you get used to wearing them a lot. And I think it's really important that people are, cognizant that it just could make the difference between being safe and not being safe, and to wear that mask.
Yes, and Dr. Jan, a lot of the youth are probably also using it as their own accessory, the mask.
Well, that was one of the things, because I hadn't been out for so long, and I started going out into public and realised, I could colour coordinate masks and clothes. It was a revelation to me. But I think this is the thing that I see a lot of younger people, instead of wearing the blue surgical mask, they're wearing a black surgical mask because it goes with so many more things. Another revelation. I think it's really important though that we don't think COVID's behind us. We don't think flu's behind us. We've got a bad flu season coming at the moment. It started early. We know that there are a lot of kids under the age of 5 who are particularly vulnerable this year because they haven't met flu for 3 years running. And so it's really important that we get those under 5s vaccinated for flu. We can't vaccinate them for COVID, but we really need to get anyone 6 months and older vaccinated for flu. But those same little things that help protect us from COVID, wearing a mask, keeping our immunisations up to date, staying home if we're sick, and keeping our hands clean help protect us from flu and other respiratory viruses. So really important this winter.
Thank you, Dr. Jan. But aside from being careful about COVID and flu, there are health issues that are important, and these are like vaping, to ensure that there are harmful effects, and we need to know this information, isn't it?
Yeah, that's right. I think the best way is to keep yourself informed and don't assume that everything you read on social media is true about these devices. For example, I know young people, a lot of the information they get is from places like TikTok and other online services. And we have to be sure that the information they're reading is correct. And that's why some of the work that we're doing in New South Wales Health is to inform young people on those platforms as well.
Thank you. Carolyn, any last words we've run out of time, but any last words for the media and our guests here online today?
I just thanks very much for your time, and I really welcome any sort of further questions or work that we can do together to protect our young people from vaping. Thank you.
Thank you so much, Carolyn, and for joining us. And Dr. Jan, any last words?
Look, I really wish COVID had gone away. It hasn't gone away yet, but there are a whole lot of other things going on in people's lives. So really encouraging people to reconnect with their GP, get those diabetes tests done, do you need cancer screening, and get your flu shot and your COVID shot, and make that plan for winter so that if you do get sick with either flu or COVID, there are medicines available, and having already chatted to your GP will just make it go that much smoother if it does happen to you.
Thank you so much, Dr. Jan. And Carolyn Murray, Director of Centre for Population Health of Public Health in your Ministry of Health, and our Senior Medical Advisor, Dr. Jan, was with us today. Thank you for answering your questions. And we will be back in the next 2 weeks. We have moved from weekly to fortnightly, and we'll try to make sure that we have updates from COVID and also some important health messages that you can share with your communities. We will be sending this recording plus a press release on the campaigns and resources available on vaping. So thank you very much for joining us. We're so glad that you always stay tuned, and we'll be back again in 2 weeks. We'll see you soon. And please encourage people to not use vaping, and also to use a mask and to stay COVID safe.